Myth and foretreatment of muscle soreness.
Have you ever felt sore pain in your muscles after your exercise session, which causes you hard to complete some basic movements, which you can do easily without muscle pain?
Muscle soreness is caused by tiny and microscopic tears in your muscle fibers.
In today's video, we are going to explore the myth and true reason why you get muscle soreness with 4 easy treatments, which you may don't know for muscle soreness. Let's get into it. Firstly, the myth is lactic acid. Does it sound familiar? Probably your PE teacher and parents have told you that lactic acid is awful and causes muscle soreness. However, is it the true?
According to research article Delayed Muscle Soreness by McIntyre and Reed, delayed onset muscle soreness, DOMS, is the real cause of soreness, which lasts 1 to 2 days following exercise. The mechanism behind DOMS is that exercise causes microscopic tears in muscle fibers. After that, neutrophils and monocytes in our body move to injury site to response to tears with inflammation, which promote the clearance of damaged tissue, eliminate microbial invaders, and prepare the tissues for repair.
Warm up and cool down have preventive effect on DOMS. According to research by Olson, warm up and cool down group have lower visual analog scale VAS scores for muscle soreness. Secondly, start with submaximal exercise. DOMS is caused by intense exercise. According to research by Salton shows, warm up at least 10 to 20 minutes of submaximal exercise is required to reach a plateau in muscle temperature. It can minimize the effect of DOMS.
The first treatment is massage. Using a foam roller for self-massage or general massage can alleviate soreness. According to research by Zainal, massage duration has been between 8 and 30 minutes in previous studies. Most groups reported that massage had a positive effect on DOMS. According to research by Guo, the mechanism is modulation of the activity of the parasympathetic nervous system. Also an increase in blood and lymphatic flow to rapidly clear the biochemical markers of muscle damage. Psychophysiological response. Second treatment is cold water immersion, which is slightly better than passive recovery in the management of muscle soreness. The research by Salton indicating that water temperature of from 11 to 15 degrees and 11-15 minutes of immersion provides the best results. Reason is because reduce lymphatic and capillary cell permeability, resulting in decreased fluid diffusion, which assist in the reduction of the inflammatory process.
Third treatment is rest. Rest until muscle fiber fully recover, then muscle soreness will be gone. Passive recovery is the most simple way to heal. Just try to get more sleep and don't use sore muscle. The final treatment is elevation, propping up the injured or sore area, such as on pillows while applying ice and anytime you are sitting or lying down. Try to keep the area above the level of your heart to help minimize swelling. It can improve blood flow circulation at sore area to speed up the recovery. Hope these treatments can help you to alleviate muscle soreness. If you worry that you may forget it, just remember, RICE. RICE stands for rest, ice, compression, elevation. Thank you so much for watching the whole video. If you like the video, please give it a thumb up and subscribe to this channel so you will get more awesome top tips for athletes or general health. Also, share with your friends and leave a comment below.